All right, welcome back. We're talking about hamstring strain recovery. In this video, just walking you through the phase 3 recovery process, giving you a little bit of an outline. So goals for this phase of recovery are you want to be asymptomatic in all activities. So that means no pain or restriction in any of your daily kind of like movements, and then you're also reintroducing sport-specific drills, so that'll be particular to your sport or your kind of exercises that you tend to do, and you want to be pain-free in all of those. So in the clinic, we're still using acupuncture to help this process. We're looking a little bit more at addressing any muscle inhibition or imbalances that might be present. So muscle inhibition is where the muscle strength is sort of decreased due to injury to sort of slow you down and everything. So we just want to make sure that we're addressing any imbalances that have built up from the injury and recovery process. We'll also be using acupuncture to sort of address the injured area as well, to continue to promote healing and remodeling of the scar tissue there. And herbs can also be useful to encourage overall healing and recovery if necessary. Now, outside of the clinic, you're going to be starting to increase speed and intensity with your exercises, and as I said before, incorporating sport-specific drills. So if you're an athlete, you'll be working with your coach or your physio to figure out the specific drills you want to be incorporating to get you back to normal full intensity exercise. But for everyone, you want to make sure that you continue using pain as your guide. So if you do a workout and the next day you pull up a bit sore, that was a bit too much, and you need to just regress and eventually build back up to it. You'll get there sooner or later, but it's better not to push it, because if you push it, there's a chance of kind of like re-injuring it and sort of making things worse. So make sure you're paying attention and you're working with a healthcare professional. You want to keep moving every day, like we've kind of mentioned in the other phases. So gentle movements are really good. You can be doing a little bit more intensity now that things are moving and feeling a lot better. So keep that up every day. But your specific rehab exercises, you want to limit these to like 4 to 5 days a week. So you want to make sure that you're actually having recovery days throughout the week, and giving yourself your body a chance to rebuild and repair. So I'm going to cut to another video in a second, sort of cover those extra exercises that you can add in. But I will just mention you can use the previous phase exercises as warm-ups. The phase 2 exercises that we just covered, you can start adding some weights if you want to, like just some light weights to some of those movements to sort of give that a little bit higher intensity, and then incorporating some of these other ones that I'll cover in a sec. All right, so for the first sample exercise for this final phase of recovery, we want to start getting you back in towards running, but we don't want you sort of running or sprinting at full intensity just yet. So to start simulating that kind of like range of motion and movement, you can actually start skipping, because it's a little bit of a less intensity. So I don't mean skipping with the rope, I mean literally kind of as you're a kid kind of skipping through. And obviously doing that somewhere where you've got a little bit of room to do that, and doing that for a couple of minutes when you're doing your rehab routine will help just get that movement and range of motion through there. All right, and so the next exercise for this final phase of recovery, now we're starting to pick up so you've done the skipping, now we're going to start to pick up the intensity a little bit more, but we're not going for too much of a run, and we're also practicing changing directions, which is where the hamstring is most vulnerable during those change of directions. So for this one, we're just going to do forwards and backwards jogging, and it just is you only really want to do this over a short distance as well. So you're just going to kind of sort of jog forwards and then jog backwards and then jog forwards, and obviously repeat that for just up to a minute or so with your rehab exercises. All right, and finally for this phase, you kind of want to be working with your trainer or with somebody who can start reincorporating the like specific sports drills for you to get back into. So you're looking to start to reintroduce more agility kind of work, that will be dependent on the kind of exercise that you already do. If you're not really an athlete, then this part isn't as important. You can just follow the other exercises until you're comfortably doing the exercises that you were before. But yeah, if you are an athlete, you just want to make sure that you're working with somebody a little bit more closely on this. All right, so how do you know you're ready to go back to sport, back to exercise, back to normal life? You and your practitioner will be looking for full strength and range of motion without pain. So healthcare professional will have some kind of like muscle tests to make sure that your range of motion and your muscle strength is sort of back up to scratch. And you also want to be able to perform all the exercises and all the sport-specific drills without any pain. And that way, you kind of put yourself in the best kind of position not to re-injure yourself when you go back into sport. But just keep in mind that 1/3 of hamstring strains do re-injure within the first year. So it is really important to keep on your recovery process, like keep up the rehab exercises, looking to rebuild symmetry in strength and mobility, both sides, and just checking in with your practitioner periodically to make sure you're on the right track. Anyway, I'll cover a little bit more of like maintenance and prevention in another video, so stay tuned for that. Thanks.